Good afternoon, thanks for joining us again today. As usual, I'll give a report on the latest statistics. The total number of positive cases reported yesterday was 559, which is 7% of the total number of tests that were carried out, and that means the overall number of confirmed cases is now 192,375. 123 of the new cases were in Greater Glasgow and Clyde, 112 in Lothian and 97 in Lanarkshire, and the rest of the cases were across 9 other health board areas. 1,428 people are currently in hospital, which is 15 fewer than yesterday, and 102 people are in intensive care who have tested positive or been admitted to hospital with COVID within the last 28 days, and that is 2 fewer than yesterday. I can also report that no additional deaths were registered in the past 24 hours of patients who first tested positive over the past 28 days. However, as you always hear us say on a Monday, the figures we report on Sundays and Mondays can be artificially low because registration offices tend to be closed at the weekends. Since the last update on Friday, there have been 49 new deaths recorded, which means that the total number of deaths under this daily measurement is now 6,715, and yet again I want to convey my condolences to everybody who is grieving the loss of a loved one. I'll also now give an update on the vaccination programme. I can report that as of 8:30 this morning, 1,255,190, I'm going to say that again for the benefit of our BSL translator, 1,255,190 people had received their first dose of the vaccine. That includes 31,416 people who were vaccinated over the course of yesterday. And that means that in total, 81,745 people received first doses over the weekend, and more than 388,000 received first doses over the course of the last week. Now, today, mid-February, is the final day of the period during which we said we would have offered vaccine to everyone over 70 and everyone who has an extreme clinical vulnerability. We'll report today's numbers tomorrow, but I can say now that we are satisfied that we have met that target. Everyone in these groups has been offered the vaccine. However, I want to say this, and it's important that I say it up front, that as will be the case in any large-scale system, we can't rule out that some people might have slipped through the cracks, perhaps wrong addresses or letters going astray or for some other reason. So if you think that might be you, please let us know. Lots of you, or some of you, have been emailing already. Get in touch, first of all, with your GP, phone the helpline, or, as I've said before, as a last resort, you can email me at firstminister@gov.scot. Now, what I would say is that we will get to everybody if there are people who have not yet been reached because of one of the reasons that I have highlighted today. This is a vaccination programme in which nobody is going to be left behind. Now, it's also the case, of course, that some people who have been offered an appointment might have rebooked to a date after today. We know, for example, that quite a significant number of people had to rebook last week because of the severe weather. However, and this is also what gives us confidence in our meeting of this target, we already have levels of uptake in these priority groups beyond, significantly beyond the 80% target uptake that we set out in our deployment plan. So in the over 80s groups living in the community, we know we have vaccinated pretty much everybody in the older people's care home group. But in the over 80s group living in the community, we now look to have vaccinated close to 100% of the number estimated to be in that group. As I've said before, we can't be absolutely sure that we've got the estimate of the number of people right to the very last person, but the estimate shows that we are close to having vaccinated everybody in the over 80s group. For those aged 75 to 79, we have reached more than 99% of the estimated number in that group, and for the 70 to 74 age group, and many of them may be getting vaccinated today, uptake is already 85%. And although this next group isn't actually part of the target for today, I can report that we've also now vaccinated with the first dose 53% of those in the 65 to 69-year-old age group. So these are, without a doubt, significant achievements. In the weeks ahead, we expect that the first doses that have now been given to people in these groups will reduce deaths from COVID significantly, and they will also have an impact, although perhaps a smaller one, on hospital admissions. Now, I indicated last week that the rate of vaccination may well decline a bit this week, and in fact, we are unlikely to vaccinate more than around 30,000 people a day this week. That's partly because we've had such high uptakes in recent weeks, but also partly, as I said last week, because we will have a lower supply of vaccines available to us this week. However, we will be able to and stand ready to pick up the pace of vaccination again as soon as supplies allow. But at this stage, I want to sincerely thank everyone who has been involved in planning and delivering the vaccination programme, and of course to everyone who has rolled up their sleeve and accepted the JAG. I know it hasn't always been straightforward, especially given the severe weather of the past few days, but the progress made is hugely important and hugely appreciated. But let me repeat again, if you're in one of these groups and you haven't yet had an appointment or you haven't yet had your vaccine and you think you might have been missed, make sure you let us know. Phone your GP, phone the helpline, or as a last resort, email me, and we will make sure that we get an answer to your question. Now, I'm joined today by the Chief Nursing Officer, who's going to help me answer questions in a moment. Before then, though, I've got two other issues that I want to briefly update on. The first is to highlight what you're probably seeing in the media today, and that is that our new rules on overseas travel have come into force. From today onwards, all international travellers arriving directly into Scotland by air from outside the rest of the UK, Ireland or other parts of the common travel area will be required to stay in a specially assigned hotel for a 10-day period of managed isolation. People arriving from Ireland will also be required to follow these rules if they have come from a high-risk country. So if they've travelled to Scotland via Ireland from a country that is classed as high risk. During the 10-day period of managed isolation, travellers will be tested for COVID twice on day 2, and the importance of that early test, given that we're trying to avoid here the importation of new variants, is so that genomic sequencing could potentially be done, and then they'll be tested again on day 8 after their arrival. The purpose of that later test is to try to make sure people don't have COVID before they are released from the isolation. Now, the approach we've taken here in Scotland, as I've set out before, goes a bit beyond the measures that have been announced by the UK government so far. We are choosing to require travellers from all countries to isolate, whereas the UK government is only applying this restriction to travellers coming from designated high-risk countries. It is, of course, up to every government to make their own judgment and take their own decisions. But at the moment, anyone who lands at an airport elsewhere in the UK and then travels on to Scotland won't be put into a hotel for managed isolation if their flight is from a destination outside the UK's list of high-risk countries. They will instead be required to quarantine at home for 10 days on return to Scotland, and also be required to book a testing package so that they will be tested on day 2 and day 8 as well. Now, the reason why we have decided to adopt stricter rules is because we think it is important to go as far as we can. For example, just having this policy apply to high-risk countries, it doesn't provide protection when people travel from a high-risk country via a third country, or perhaps when a new variant is present in a country which isn't yet on the high-risk list. So our measures are designed to reduce those risks for Scotland as much as we possibly can. But we do recognise, and we have always recognised, that a common four-nations approach to travel restrictions is always going to be preferable. For a policy like this to work effectively, it requires people to isolate as close to the point of arrival in the UK as possible, rather than, for example, travel from England to Scotland before isolating, because, as you can imagine, it would then be possible that somebody would have taken the virus quite a distance. So for that reason, we want to continue to work with the UK government, and we will try to persuade it to adopt more comprehensive measures, or failing that, to help us ensure that people arriving at airports in England but who intend travelling to Scotland are required to isolate in hotel accommodation at the point of arrival. But of course, for all that this is important, we wouldn't be doing it if we didn't think it was important. The most important message of all right now is that we are saying to everybody that you shouldn't travel at all right now unless it is absolutely essential. Almost all travel to and from Scotland is currently against the law. There's only a small number of essential purposes for which travel is permitted. So the managed isolation rules are an important additional safeguard, but the most important safeguard of all at the moment is the fact that you shouldn't be travelling at all unless it is essential. Now, the second issue I just want to mention before drawing my remarks to a close would be important at any time, but I'm mentioning it today because it is especially important given the financial impact that the pandemic is having on some families. The Scottish Child Payment, which gives eligible parents and carers an additional £10 a week for each child initially under the age of 6, is formally launching today. That means that Social Security Scotland can now start making final decisions about eligibility for the payment. So far, more than 77,000 applications have been received. It will take time to process all of them. And so the first payments, which will be made every 4 weeks, will start to arrive with families from the end of this month. But I want to reassure parents that even if you don't receive your payment for a couple more weeks, the money that is due to you will be calculated from today onwards. And I also want to stress that it is still possible to apply for the child payment. The payment is open to parents and carers on low incomes who receive benefits such as universal credit. So if you fall into that category, have a young child and have not yet applied for the payment, you can find out more about eligibility on mygov.scot website. And if you think you are eligible, make sure you apply as soon as possible. Many families have been really hard hit by the pandemic, so this is one way in which we can do more to help. Now, these are the main items I wanted to update on today, so let me finish as usual just with an encouragement to please stay at home apart from essential purposes. That is the key thing everybody's doing right now that is helping to get these virus levels down while we vaccinate more and more people. So unless you need to care for somebody or do essential shopping or exercise, please stay at home. Outdoors, limit your meetings to just one other person from one other household. Work from home whenever you can, and employers, remember you have a duty to facilitate your staff working from home wherever possible. And if you are out and about, remember facts. Wear face coverings, avoid places that are crowded, clean your hands and surfaces, use 2 metre distancing, and self-isolate and get tested if you have symptoms. But above all else, the most important thing we can all continue to do right now is to stay at home to protect the NHS and save lives. Thank you for listening. We will now move straight to questions, and if I can find my list, our first question today comes from Sasha Spratt from STV.
Good afternoon, First Minister. Firstly, how much are you ultimately relying on goodwill from people who may be travelling through other parts of the UK and them not finding loopholes in the system? And also, how likely do you think it is that the UK government will align with the rules that we have up here?
I think people's, you call it goodwill, but I think I would characterise it as people's willingness to abide by guidance and certainly abide by the law has been, very strong right throughout the pandemic. And, I don't think I'll ever be able to sufficiently express my gratitude for that. And I would encourage everybody, whether it's travel restrictions or the stay-at-home requirement or what we're asking people to do when they're out and about, the more all of us do what we are being asked to do right now, the faster we'll get infection levels back down, and the sooner, hopefully, we start to reintroduce, even if it is gradual, some normality back into our lives. On the point about the UK government, let me stress, I'm not standing here criticising one government over another. We all have a duty to take the decisions we think are appropriate. When I look at not the only risk we face in the next few weeks, but certainly one of the significant risks as we suppress the virus here, that is importation. Now, we know that happened as we came out of lockdown last summer. We suppressed the virus to very, very low levels here, but it was reseeded from travel. That's a risk again, but actually it is probably a bigger risk now because we know the virus is mutating. So it's not just the virus that we risk bringing into the country, it's new variants of the virus, which, as we know from our experience over the last couple of months, can really throw us off course quite considerably. So I think we've got to protect against that to the best of our ability. The problem with just imposing quarantine in a managed way on people coming from high-risk countries is that we don't know new variants are only in high-risk countries. Not all countries do very much genomic sequencing, so it's possible that some countries we don't deem right now as high risk also have new variants that are already circulating. So unless we impose managed isolation in a comprehensive way, we risk letting the virus come in. Now, clearly, we can only do that directly for people coming directly into Scotland. And for people who intend coming to Scotland but fly via Heathrow, for example, we have to work with the UK government. And there are two things that we want to continue to try to come to an arrangement around. Firstly, and this would probably be the best arrangement if the UK government decided to apply it on a comprehensive basis as well. But if not, then to work with us so that people who are destined for Scotland but come in through an English airport, that requirement to isolate can be imposed at the point of arrival. Now, people will say, why don't you check people coming across the England-Scotland border? Now, of course, we don't rule anything out in terms of how we might have to deal with the risk of travel. But in a sense, if that is the solution, we're already undermining the policy because somebody will have travelled quite a distance before they get to that point. So that's why isolation as close to the point of entry is so important here. So I've raised this with Michael Gove in our regular Four Nations discussions. Jean Freeman and Michael Matheson have raised it as well. And I heard, I didn't hear the whole interview, but I heard a clip of Matt Hancock on the radio this morning saying that he was willing to continue to talk to us about this. So I welcome that, and hopefully we can get some progress in the days to come. Peter McMahon from ITV Border.
Thank you very much, First Minister. If I could just follow up on that point. Michael Matheson, your Transport Secretary yesterday, did say a lack of cooperation from the UK government was undermining your plan. So that was criticism of the UK government. If you don't rule anything out, and if the UK government won't move, and if, as Michael Matheson said, there is, and you have said, there is this enhanced threat of reseeding, potentially from this new mutation of the virus, you've always said you have the powers, if you need to try and close the border. Should you not be doing that?
Well, look, I don't rule it out. I would like to have the most effective system in place here. So, you know, I'm not sure it is the best solution to have. No, if it's the only one I can put into place, then it may come to that. But why let somebody travel halfway across the UK before you do that? So it would be better if we had that Four Nations approach, or certainly at least a Three Nations approach, where the border of the island that Scotland, England and Wales share had the same provisions in place. Now, I'm trying to be constructive here. I often get criticised, sometimes fairly, sometimes unfairly, for being critical of the UK government. Then sometimes I get criticised for standing here trying not to be critical. I just want us to try to come to the best solution possible. You listen to any, you know, serious public health expert right now, and they say not just for Scotland, but for the whole of the UK, this is one of the biggest risks we face. So why leave these loopholes, and why be in a position where we're trying to put in place second best solutions if we can continue to talk to each other to come up with the best solution? But at the end of the day, you're right, my responsibility is to try to protect Scotland as much as possible. So if it just proves impossible to do that, then we have to look at alternatives. But it would be far better to try to come to a reasonable agreement on a Four Nations, or as I say, at least a Three Nations basis. Suzanne Allen from the BBC.
Thank you, First Minister. Last year, you issued Scottish football with a yellow card after players breached COVID rules. It appears then that Rangers players have breached rules again by attending a house gathering for the second time in 2 months. So what will it take for you to issue football with a further yellow card, or indeed a red card?
I I tell you, sometimes I feel that it's taken me all my power not to stand here and use expletives whenever I get asked about football again. I don't know yet. I've not been given all of the details of the Rangers incident yet. I know, no doubt that will happen when the details are clearer. I know the club has said that they are investigating. But let me be clear, whenever football rears its head in this situation, I get emails from people suggesting that I'm somehow partial in favour of or against one team or the other. That's not true. I don't care what club it is that's breaching the rules. If you're breaching the rules, you're in the wrong. And it's really frustrating. Not just to me or the government. I suppose that's not the most important thing, although believe me, it is really frustrating. But it's really unfair to the vast majority of people in the country who don't have the privileges that elite sports people have right now. And therefore, when they see elite sports people breach these rules, and, let's also be frank, the vast majority are not, but when a small number do, then people think, why am I bothering? So can I say to football and sport generally, please make sure your house is in order, because it shouldn't take me standing here to say to highly paid footballers that you've got to obey the rules. It really shouldn't take that. But the fact that it does is hugely frustrating to me. And I don't care whether it's Celtic, Rangers or any other club. It's not on. So please stop breaking the rules. Becky Clark from Global.
Good afternoon, First Minister. If I can return to the issue of hotel quarantine, we've been at Edinburgh Airport this morning where an Istanbul flight, originally with 60 people booked on board, has arrived with just 4 people who will then go to managed quarantine. When those people could book a flight to Newcastle or Manchester for a few £100s and travel up, but they have to pay more than £1,700 to quarantine in hotels. Is there a worry that people will just take that option and that's, more attractive to travellers to Scotland?
Yes, and that's why we continue to consider what we have to do to avoid that. But the best way of avoiding that is to persuade the UK government to have the same approach we do. I don't know. I'm not a UK government minister. It's not my responsibility, and I can't take decisions for them. I suspect that sooner or later they will have this position. I hope it's sooner rather than later, so that we can have a situation where, in terms of the island as a whole, we have maximum protection from having the virus, and particularly new variants of the virus coming in. And that's what we will continue to work for. If the UK government don't do that, then we will continue to consider ways in which we can try to strengthen this. But, I can only be responsible for my decision making. I can't force the UK government to do certain things, but when they don't, it does create additional challenges that we've got to try to overcome, and we will continue to do that in the best way possible. But I'd say to the UK government, if the solution here, and if we have to do these kind of things to protect Scotland, then that's what we have to consider. But if the solution here is to let people travel halfway across England, potentially with new variants of the virus being carried with them, and then only get checked as they come into Scotland, I would suggest that's not a great outcome for people in England either. So let's try to work together to get a sensible position in place. Do you want to say anything about the importance of travel?
I think these rules are being put in for safety. They're to stop people becoming ill, overwhelming the NHS, and deaths. And therefore, people who would deliberately circumvent that, I would ask them to think again. This isn't a way to get a cheap holiday or a way to get less money on their flights. This is about saving lives. It's about making sure we as a society can return to normal as soon as we possibly can. Our children are desperate to get back to school. Our young people are desperate to see their friends. And we have people all over the country who have borne this lockdown incredibly well, and we're very grateful to them. So what I would do is urge anyone who's travelling is to understand it's not just for their safety, but it's for the safety of their communities and their loved ones. And it's incredibly important that everyone absolutely sticks not only to the letter of the rules, but also the spirit of it.
Just say 2 additional quick points here. One is just to pick up on something that I've received a few messages about over the course of the period we've been talking about these quarantine rules, and that is a perfectly legitimate point, that when we talk about, and I know I'm probably prone to this as well, when we talk about international travel, we tend to talk about it in the context of holidays. Now, for many people that will be the correct context, but of course there are people who live in Scotland, who have family overseas, or who are from overseas and want to go backwards and forwards. So just firstly to recognise that I know that international travel is not holidays for everybody. Sometimes it is essential family contact. But the second point is this: when we're talking about this need to quarantine and the issues we've got in trying to get agreement with the UK government, don't lose sight of the fact that there should be very, very few travellers at all at the moment, because it should only be for essential purposes. So if you find yourself having to book a flight from Scotland to somewhere else, or from somewhere else to Scotland, you really should be asking yourself, is it strictly necessary? Is it really, really essential? That's the first line of defence here at the moment. The managed isolation, managed quarantine is a additional safety net, but please don't travel unless you really need to. Neil Pooran from PA.
Thanks, First Minister. On the return to schooling, I appreciate you'll be setting out in full your decisions in Parliament tomorrow. I was just wondering if there's any evidence or any new statistics you've seen over the weekend that might sort of make you reconsider the February 22nd date for the return of some pupils. And if after the Cabinet meeting, do you feel you'll be able to update parents and pupils with a timetable on when they will be able to return?
The Cabinet, excuse me, I've got an itchy eye. The Cabinet will meet tomorrow morning and take a final decision on the return to school on the 22nd of February, which, just to remind everybody, was for early years children, primaries 1, 2 and 3, and for a very small, limited number of people in the senior phase of secondary school who need practical face-to-face learning as part of their qualification certification. So we will look at the up-to-date data and we'll take a decision, a final decision on that tomorrow, as we always said we would. I am very, very, very keen to go ahead with that if at all possible. And I know the whole Cabinet is of that view. We will also consider whether it is possible at this stage, but here I don't want to raise expectations too high at the moment. We will consider to what extent it is possible to lay out even an indicative timetable for the next groups of pupils that are perhaps likely to return to school. But that's not going to be immediate, and that's where I just want to be careful that I'm not raising people's expectations. But I will set out more detail on all of this to the extent I'm able to in Parliament tomorrow when I make a statement after the Cabinet meeting. The only other thing I would say here, and I don't want, please, you to take what I'm about to say here and sort of automatically read it across to what I've just said about schools. All of the data right now is encouraging. All of the data, and you can hear it when I set it out every day, is going in the right direction. As we saw in periods last year when we were suppressing the virus, we sometimes seem to hit perhaps a period where the decline starts to tail off a little bit. So you see case numbers plateauing rather than sort of declining quite firmly. We may be starting to see a little bit of that in Scotland right now. It wouldn't necessarily be that unexpected, but it's something that we just have to be mindful of as we look forward to potential timetables for easing lockdown more generally. But I don't want that to take away from the fact that the data has been going in the right direction. The one other point just to make about the data, which again is not really surprising, we think lockdown, well, we know because we can see it in the figures, is working, but we're probably suppressing the sort of older variant of the virus faster than the new variant, which is declining at a slightly slower rate because it's more infectious. But that said, we are certainly encouraged that lockdown is still working to suppress the newer variant. So we'll look at all of this data tomorrow at Cabinet, and I'll set out our thinking and the final decision around the return of these groups of pupils to school on the 22nd of February tomorrow afternoon.
And I think NERTAG's given us quite clear advice for returning to school, is that with the new variant, the extra vigilance has to be taken about current mitigations that are going to be in place. So what we would say is if schools do return, or clearly they're open just now, but if the early years and the 1, 2 and 3s go back, what we would urge is those who are taking and escorting their children to school is that they pay particular attention to their 2 metre distancing, their wearing of their face coverings, and making sure that they keep things as safe as we possibly can. And of course, the local public health systems and Public Health Scotland are keeping watch on what's happening within schools. So we will be able to monitor the impact of this early return to schools should it happen, and just make sure that things are all that they should be.
And I'll say more about this tomorrow, but if we do go ahead on the 22nd of February, another really important point, which Fiona has just alluded to there, is that this will be a return of groups of pupils to school for education. What is really, really important is that that's not then seen as a trigger for people who are currently able to work from home, going back to work, or parents deciding to meet up with each other more. What is often the risk factor around schools is not transmission inside schools, it's all of the activity that takes place around schools. So that's going to be really important, that if we are able to get schools back even in a limited way, it is simply for young people and education. And we all must continue to abide by the other restrictions that will continue to be in place. Mark McLaughlin from The Times.
Good afternoon, First Minister. You referenced Matt Hancock's interview on the radio this morning. You would have also heard him say that he's had no direct discussions with Scottish ministers about the quarantine loophole. Jean Freeman said she had a Four Nations call with counterparts last Thursday. So who's telling the truth here?
I can only speak for myself. Jean Freeman, I know, had a Four Nations discussion. I am assuming Matt Hancock was part of that because he's the health minister. And I personally have raised this on Four Nations discussions, the need for us to discuss how we manage these loopholes. So, you know, I know that these things have been raised. I think Michael Matheson, double check this, I'm pretty sure Michael Matheson has written to his counterparts. So I just don't think it would be credible for UK ministers to say that this was not something that had been raised with them. I hope we can have constructive discussions, and I hope we can reach solutions that will be in the best interests of people in all parts of the UK. Tom Martin from the Daily Express.
Hi, thank you, First Minister. If we could just return to the vaccine rollout. Obviously, in your opening remarks, you say you're satisfied you've met today's target. But again, just going back to this issue we talked about last week in terms of the clinically vulnerable. I know you said you had difficulties in getting data out on that group that involves 110,000 people. So I just wondered how confident are you managed to get to them, given we've not seen any data as yet on that. And secondly, you referred to reaching more than half of the 65 to 69-year-olds now. The vaccine deployment plan gives a target of early March for the completion of that. Do you have a specific date in mind for that group?
We are still working to early March. I will insert the obvious caveat there that that is supply dependent, but that's still the date we are working to. And, you know, we are already more than halfway through that group, which is a really, really good start. Remember, the target for today was, in an age sense, was just over 70. So the fact that we've already done over half of the 65 to 70 is beyond where we thought we might be at this stage. So the early March target is still what we hope to meet, but I've been pretty open about some of the supply challenges we might face over the remainder of February. Overall, we don't expect our supply to be less than we were anticipating, but the phasing of that supply, together with the higher than expected uptake in the groups we've vaccinated so far, mean that we have a couple of weeks where we might have lower levels of supply than we had previously anticipated. On the clinically extremely vulnerable, Fiona might want to say a word. This is the hardest group to get, concrete estimates around, because it's often based on clinical judgment. So there may be people here who think that they haven't been offered the vaccine when they should, and that may be down to the definition of clinically extremely vulnerable, and perhaps a GP doesn't think somebody is in that group. So in that group in particular, if you have questions and doubts about the fact that you've not been offered a vaccine so far, definitely get in touch with your GP, and as a last resort with my office, because we want to make sure everybody is vaccinated who feels that they need to be and whose GP feels that they need to be. We will try to put data out there on the same basis as we do with the age groups, but we've said all along there is greater uncertainty just around the total numbers in these groups. But based on the information that is available, we are satisfied that people have been offered the vaccine here. But I repeat the invitation to anybody who thinks that's not the case to get in touch.
And our GPs have been amazing in terms of helping support the delivery of the vaccines to our over 80s and also to those who are clinically extremely vulnerable. And just because you may have two people with the same condition or you may have two people on the same drug, but that doesn't necessarily make one of them clinically extremely vulnerable and the other so. So I think some of it is, for sure, it's obvious to the GP practice and they will call these people in and have been calling them in and give them their vaccination. For others, it needs a bit more granular understanding of the absolute condition, and therefore that takes a bit more time. But our GP practices, they know their patients, they're keen to get everyone vaccinated as soon as they possibly can, and they're actively working on that. And I would encourage people who have any queries on that to contact their GP practice or their practice nurse and have that discussion, and they can reassure them.
Thanks. Chrissy Lavelle from The Sun.
Thank you, First Minister. Just on schools, the EIS has claimed that the increased transmissibility of the new variant has been underplayed in the Scientific Advisory Group's report to the Scottish Government. And therefore they want part-time blended learning in primary schools as well as physical distancing. How would you respond to this, and do you think that your expert advice has underplayed the role of the new strain?
No, I mean, I'm not going to stand here and try to speak for the experts who advised the government. It would be wrong for me to do that. They can speak for themselves should they think that is necessary. But I don't think anybody could reasonably say that the government has underplayed the transmissibility of the new variant. On the contrary, it's what, persuaded us to put the country into full lockdown again and to close schools again. So it's something we take very, very seriously. And it's also because we understand the risk of a more infectious variant that we will take and are taking a very gradual and phased approach to the return of schools. But we know it's important to try to get young people back to school, so we will continue to do that appropriately. We'll continue to consider it very, very carefully and take the decisions that we think are, on balance, the appropriate ones. And that will include reasonable mitigations. We've always recognised the greater difficulty in very, very young age groups of imposing rigid physical distancing, for example. But we will have mitigations in place that are, age appropriate and absolutely recognise the risks that are faced. So these are not decisions we take lightly, but we want, as I think everybody does, to get young people back into school as soon as we think it is safe to do so.
And there are many sources of evidence. The World Health Organization, NERVTAG, SAGE, all have views and give advice on education. And we know how important it is for young people to access. We also know how important it is to the teaching profession, who are professionals who are really, really committed to making sure that children and young people have that learning. So we are keen, but we're not going to rush that. So the evidence for early years and primary 1, 2 and 3 is that even with the new variant at the moment, there is no evidence that is causing an increase in transmission, and therefore the regulations and the guidance stay the same for that. And as young people become older, so in the older age group, so in the secondary schools, so that's where the 2 metre distancing has been advised both in school and also on school transport, because there has been evidence of increased transmission. Now, overall, we also know, again, the evidence is there that families who have children in them are actually less likely to have COVID-19 within that family. So we're working with quite a broad evidence base, and we're making sure that we can apply that to keep our children and young people and our teachers and support staff as safe as they possibly can be. So mitigations such as offering testing, supporting the 2-metre distancing and wearing of face coverings where appropriate are all being put in place to make sure that our schools and our school system are as safe as they possibly can be, so our children and young people can thrive.
Michael Blackley from the Mail.
Hello, good afternoon. If I could just return to the issue of the Istanbul to Edinburgh flight, the first that required managed quarantine. I understand in that case there were 65 people booked, only 4 actually travelled, and I hear that many of them actually turned up to the airport this morning, and it was only then that they found out about the stricter rules on quarantine hotels in Scotland. So can you just confirm what you have done to make sure that people who are currently abroad travelling back to Scotland are aware of the rules? Do you think you've done enough there? And also just more generally on lockdown, it was reported over the weekend south of the border that pubs and restaurants will open in early May at the earliest, potentially as late June. Is that the sort of time scales that you're looking at for key lockdown restrictions? Should families and businesses be prepared for several months of further restrictions?
Right now, the decisions we're focused on are trying to get children back to school. We are not imminently about to signal the reopening of pubs and restaurants. Obviously, we want everything back to normal as quickly as possible, but I'm not going to raise people's expectations that that is coming in the immediate time frame. So we'll take the decision tomorrow around schools. Over the next couple of weeks, we will set out some more thinking, and it'll be data as opposed to date-driven, I think, about the order in which we try to get other things back to normal. But, I think I said last week, you're going to hear us talk a lot about trade-offs. We won't be able to do everything for the next period, and therefore we will have to decide what is most important to us. And I think for most people, children's well-being and education, then visiting and older relatives and care homes, and more generally getting a bit more family time back. These are the kind of things that we need to focus on first as we try more generally to get things back to normal. On the steps we've taken to make sure people know about the quarantine restrictions, I'll get my team to send you the detail on that afterwards. I don't have all of that to hand, but we are taking a range of different steps through the media, through these briefings, through information that will be made available at airports to make sure people know about these requirements. But the most important message of all is don't travel unless it is really essential. Simon Johnson from The Telegraph.
Thank you, First Minister. A lot of elderly people, grandparents, will have had their first jabs now, and will be looking forward to being reunited with family in other parts of Scotland and the UK. Can you give any indication as to whether that could happen before all the top JCVI groups are done, which I think May is the sort of general timescale for that, or is that have to happen first before grandparents can meet their grandchildren again? Thank you.
No, I can't answer that right now. And actually, I think people are anxious. I know they're anxious to see family. We're all anxious to see our families normally, but I think people understand what we are dealing with right now. So I'm not going to say either way right at this moment, because I can't, whether it can be done sooner than the whole JCVI list being vaccinated, or it requires to wait for that, because in part it will require more evidence than we have right now of the impact of the vaccine in stopping the transmission. We are pretty confident, and I would say that I think we are already seeing this in care homes, that it is reducing deaths from COVID, but we don't yet have the same certainty about whether the vaccine stops people getting and passing on the virus. And until we've got that greater certainty, we need to continue to be cautious. So I'll continue to try to give people as much certainty as I can, but I'm not going to speculate in a way that raises people's expectations unfairly before we're in a position to say these things with a great deal more firmness than I am today. Ilsa Maishman from The Scotsman.
Thanks, First Minister. Just a question on vaccines, if I may, just about the drop in supply that you've warned us of. We've just seen a few reports about centres, vaccination centres closing around the country. I think that the most notable was Louisa Jordan. Should we expect to see more similar closures throughout the next couple of weeks? And how do they work? Is it the case that they're kind of planned in advance because you know that supply will drop and patients are told, or is it a case that appointments are cancelled because of a kind of last minute realisation that there isn't as much supply as expected? And can I just ask a second question on the supply information that you said the Scottish Government might be publishing? Is there any update on when that might happen?
On that, we had a Four Nations discussion last week. We came to an in-principle agreement that figures will be published on the amount of vaccine that has been allocated to each of the Four Nations. That will be, based on what the situation is at any given time. That would be published weekly. It won't project into the future in terms of supply, and we're just in the process of finalising that, and I would hope that that information will be published soon. On the first part of your question, firstly, the NHS Louisa Jordan is not closing as a vaccination centre. It may, over the next week or two, go from 7 days a week to 5 days to reflect the dip in supplies that I have spoken about. And it may be that there are other centres do likewise, but we're not talking here about closing vaccination centres. We try to give our vaccinators and the teams implementing this programme as much forward sight of supplies as we can. There will, in any programme like this, you can't rule out that there will be last minute, short term interruptions to supply, but this is about, as I set out last week, what we have here, I suppose there's three factors coming together for the next couple of weeks. Firstly, we've vaccinated more people than we had anticipated by this stage because of the higher uptake. So we've used more vaccine than we initially predicted we would. Secondly, Pfizer has rephased its delivery of supplies over the next period. So we're expecting to get the same amount of supply over the period to the end of March, but it will be slightly different phasing. So we will have less over the next couple of weeks than we anticipated when we first published the deployment plan. And the third factor is that we are getting close to starting having to do second doses for those who were vaccinated early on in the programme. So we're at the stage where we have to reserve stocks so that we've got enough to do the second doses as they fall due. The combination of these factors mean just for a short period, the supplies that we have will be a bit more constrained than we had originally thought, and we will have to flex the programme to reflect that. So the kind of daily figures that we have been reporting, certainly over the last week or so, where last week it was above 60,000 on some days. If I look over this week and maybe into next week, I would doubt that we will get to those daily levels, probably around 30,000 a day. And that is just about using the supply that we've got appropriately. Now, when supply starts to increase again, we will be in a position to very rapidly, so the Louisa Jordan will immediately go back from 5 days to 7 days. We're going to see these issues throughout this programme. That's in the nature of it. But that shouldn't take away from the fact that we're actually in a much better position now than we thought we would be. We've vaccinated more people right now than we anticipated. So that's a good thing. And we now have to manage supplies to make sure we can get second doses done and then get the first doses as quickly as possible to the remainder of the population. Do you want to add anything?
And as the First Minister talked about second doses, so I know that there are some health boards who are planning to go out this week to their care homes, and that will then be the trigger for looking at two streams of vaccination, and that's what we're planning for in terms of continuing with the first doses and then those who will need their second doses, and we're beginning to see that play out this week and over the coming weeks. I very much welcome the second dose to our care home residents.
And last question today, Tom Gordon from the Herald.
Thank you, First Minister. Just to pick up on the vaccine numbers there again, you said around 30,000 doses per day, perhaps, this coming week. Is that all doses, first and second, or just first doses? And secondly, on the quarantine hotels, what responsibility do you think your government bears for this loophole? Because you've announced a sort of half-baked system that has created a perverse incentive for people. So it pays them financially and in terms of convenience to take an indirect route home via England to save on the money and, you know, bother of a quarantine hotel. I mean, if you're talking about last resorts, instead of closing the border, surely a better last resort would just be to give up on your system and go along with the red list, because then people will just come home directly and go to their own home rather than meander through England and do the same thing.
Yeah, that's a bit of a misunderstanding of how it works. So on the red list right now, the loophole isn't there, because if you're coming from a red list country, you're captured, possibly not the right word, but you're caught by the system in the rest of the UK. So there is no difference in terms of red list. This is about people coming from non-red list countries. Now, yeah, I could say, well, yeah, okay.
It's because you've added these countries over and above the red list that we have this strange perverse incentive.
Well, but it's not a perverse. So the alternative to that is we have no restrictions for people from non-red list countries. Right now, people who do travel direct, the quarantine applies to them. If I'd followed what you're suggesting to me right now, people coming direct to Scotland would have no requirement to quarantine. So we're doing as much as we can, which frankly is better, in my view, than doing nothing at all. I can only do what I am able to do in Scotland. But, you know, yeah, people can take the view that we should go with the lowest common denominator and do what the UK government is doing. But that would be the lowest common denominator, and it's not providing maximum protection. And a few months from now, if we're going back into lockdown, because as happened last summer, we've reseeded into the country, and worse than last summer, we've reseeded new variants that are much more transmissible or even more severe or are beating our vaccines, then, you know, I'm not sure I want to be in the position of having done nothing or having not done as much as I have the power to do. It's frustrating that we don't have a four nations common position here, but I can't force that on other governments. I can only do what I think's right and try to persuade other governments to do what I would like them to do as well. But your kind of recipe there would be to go to the lowest common denominator and have no restrictions for people coming into Scotland if they didn't come from the red list countries. And I've already set out what the deficiencies of that system are. And on I think your first point, 30,000, I'm going to double check this just to make sure I'm getting it right, but it will not be exactly 30,000, but that will take account of first and second doses, I think, for the next period, but I'll double check that just to make sure I'm getting that right.
Is there a breakdown then? How many of those are roughly will be first and how many second?
There will be. We, I think, publish that breakdown already, so when we publish the figures, the bulk of our numbers, so when the figure I report to you every day right now is first doses, but we also publish the figure for second doses. It's much, much smaller at the moment, but the balance of that will change, obviously, as we start to do more second doses. So that is already published, that breakdown.
That's retrospective. Do you have a forecast for how that's going to break down?
The figures I'm reporting every day are retrospective. They are vaccines that have been administered. So that's what we publish every day. In terms of publishing prospective figures, we have targets and we will set out what we consider to be the time scale of getting through these groups and second doses. But I think you can sort of know that you can start to work that out yourself, because somebody getting vaccinated today will not fall due to have their second dose until 12 weeks from now. Somebody who was vaccinated in December is getting close to that already. So the time scale of the second dose schedule really follows on from the first dose schedule and the prioritisation that we've given there. Do you want to add anything to that?
I think so. In Scotland, we also publish a number of our healthcare workers who have had their first vaccinations. So on top of our care homes, our over 80s, we'll also be able to publish with accuracy how many of our social care workers and our healthcare workers will be having their second dose as well. And that is all within our planning, and we will be able to publish that as we go forwards in terms of who has been vaccinated both first and second dose.
Thank you very much. That concludes the questions. Thanks to Fiona and to Jill for our BSL interpretation. Thanks to all of you. I'll be in the Scottish Parliament to deliver the update tomorrow. I think around 2:20 or thereabouts. I'll give the daily figures, but also set out the outcome of the Cabinet's deliberations in the morning, and that will focus particularly on schools. In the meantime, please stay home. all of this talk about quarantine for travellers, please don't allow that to take away from the fact that we're asking people not to travel right now. So unless it's essential, please don't travel within Scotland, from Scotland to other parts of the UK, or to and from other countries and Scotland. That is the best way of trying to keep everybody safe. So please stay home, protect the NHS, save lives, and I will see you from the Scottish Parliament tomorrow. Thank you.